Hospital costs rather make up about a third of the 2.7 trillion, yes, trillion with a T, dollars Americans spend on health care. According to a new study in the Journal of the American Medical Association, hospital costs are also the largest driver of medical inflation. Glenn Melnick is a professor of health economics at the University of Southern California, and he joins us via the phone to talk to us more about this. Dr. Melnick, thank you so much for being with us.
My pleasure.
Let's just talk in broad strokes right now. In general, what drives the high prices of hospital costs?
Well, there's, I guess, two sets of factors. One is the input costs. Produce hospital care is expensive. It takes, highly trained people and a highly trained skill mix. But on top of that, there's the environment in which hospitals price their services, which have become less and less competitive over time. And so it allows hospitals to raise their prices more rapidly than inflation, more rapidly than GDP growth and other economic factors.
There have been a number of articles about this, and one of them, it quotes, outrageous prices for seemingly simple procedures. One example is $3,000 for 6 stitches someone received in their finger, which seems, of course, outrageous. Is a number like this, does it represent just out of control pricing, or what does that number represent?
Unfortunately, well, in some ways, fortunately, but the healthcare system, and particularly hospital pricing, is complicated because there's two sets of prices that hospitals keep. One is something they call their bill charges, which is, I think, what you're referring to there for the $3,000 sutures. And then there's the real prices that insurance companies pay or that Medicare pays. And typically, those two sets of prices are very far apart. And so so people will see a bill from the emergency room with these crazy numbers called bill charges, but their insurance company will generally pay 20% of that number. It's only when people without insurance go to the hospital that they get presented a bill based on these inflated bill charge numbers that it becomes a more meaningful statistic, because the hospital will send them that as a bill and ask them for payment, and then begin to negotiate down from there.
So I guess the question then is, who's minding the candy store, if you will? Is there any regulation in place to control these costs?
Well, the market has just like the rest of our economy, the marketplace regulates prices. So in a competitive marketplace, when you have competitive conditions, supply and demand determine what the price will be. Consumers will determine how much they're willing to pay, and producers will try to develop products and services with the right characteristics at those prices. What's happened in the hospital market over time is, initially, if you look back in time, there was a period of time where insurance companies were able to generate price competition amongst hospitals in order for them to gain access and to get contracts from Blue Cross, Blue Shield, and other insurance companies. And they would say to the hospitals, if you want to be part of our network, you have to offer the services at a reasonable price. And if your price is too high, we're going to exclude you from our list of preferred providers. And then our members, if they go to you, will not have as much insurance coverage. The hospitals competed on the basis of price in order to gain access and to be included in those networks. But what's happened over time is hospital markets have become more consolidated. And so health plans are not able to generate the same degree of price competition that they did before. And so they're not able to get hospitals basically to compete on a price basis the way they were before. And so we see hospital prices growing 8 to 10% a year, if not higher, in most markets throughout the country for the last 10 years.
And I want to, the same principle that you just laid out is, of course, the principle on which the new health care law is based, and that is forcing insurance companies to provide coverage at an affordable price. So what I'm wondering is, when the law has fully kicked in, will the Affordable Care Law have any impact then on the cost or the charges that hospitals can charge?
Well, the answer is it's multiple effects. So in the short run, a number of economists are worried about the effects on prices. So the goal of the Affordable Care Act is to bring fairly quickly 7 million people into the insurance system with insurance cards. And, in states like California and a few other places, the increase in the number of insured population as a percentage of the total will be significant. So you'll have a surge in demand for care, but at the same time, the supply is not going to increase very rapidly. You can't build new hospitals overnight. You can't train new doctors. And so there's a concern that we'll see a spike in prices in the insured population, because now health plans are going to go out and look for contracts with providers, and the providers are going to say back to them, we're really busy.
Let me jump in, Glenn, if I can ask you a couple of quick questions before we're out of time. First of all, is a hospital under any obligation to disclose their price list? And if so, should people shop around based on price?
Yeah, it's a state-by-state regulation. So California has a disclosure law. The problem is the prices that they post are not particularly meaningful. They will post charges, which is not really the price that most people will pay under their insurance. So you've raised a really important issue, which is going forward, healthcare providers, hospitals, and doctors are going to have to get much better at telling their patients, what is this going to cost? Because more patients are going to have to pay a percentage of that price out of pocket under their insurance plan. Right now, there are no regulations, but I think there do need to be regulations to force that kind of transparency.
All right, we're going to have to stop the conversation right there, but thank you so much. Glenn Melnick, we really do appreciate it.
My pleasure.